you can say that the skin is the place to be, not the lung, not the nose. And even allergy to house dust mite, it has been shown it occurs through the skin. So that's a very new concept. We have to try to keep the skin good. And when we can do that, we can avoid, we can even prevent the development of allergy. And if you look at children with eczema, and you look at the allergic reactions, it's mainly in the beginning of life that they have the food allergy. And food number one is egg. And we consider egg as the house dust mite of the foods. Egg allergen is very light, very airborne, and it's everywhere. Indoors, not outdoors. So if you want to avoid contact with egg, you have to live outdoors. Same, if you want to avoid contact with house dust mite, the only thing to do is live outdoors. Because house dust mite is everywhere. And if you buy yourself an expensive vacuum cleaner or a cover, it doesn't work. Because house dust mite is everywhere, in the shopping center, in the school. So the only way to avoid house dust mite and egg is live outdoors, have an outdoor lifestyle. Just only go indoors, go to your bedroom to sleep, and don't stay all day in your bedroom. And then they grow out of their food allergy. We don't know why. We don't know why. Don't ask me. I don't have the answer. But then in the meantime, they develop house dust mite allergy. And the eczema continues. And then staph comes in. And many doctors forget this. They forget to kill the staph. And the treatment doesn't work. And the parents go to another doctor. And that's what's happening with a lot of children with eczema. So in older children with eczema, it's the house dust mite. And we all come into contact with house dust mite in our bed, in the couch, in the curtains, on the floor, they are everywhere. And it's the house dust mite plus the Staph aureus that cause severe eczema in older children. So in young children it's mainly food allergy, but they grow out, and then they start developing house dust mite allergy, and then staph. And both like each other. They marry in the skin. And they produce a lot of proteases. Professor Wang mentioned it, and it's the proteases that destroy and keep destroying the skin barrier. So allergens, all kind of allergens come in. So eczema in children, it looks the same at all ages, but it's very dynamic. In young children, food allergy, number one is egg. Number two in Singapore is cow's milk. In older children, no more food allergy. Very rare, never say never. But most older children with eczema, no food allergy, but house dust mite. And of course, at all ages, don't forget the role of germs. And if there's one thing, just one thing I want you to remember from this talk is germs, the role of germs. So it's a complex disease, eczema, because there's a lot of factors involved. Atopy, genetic factors that are associated with skin barrier, and then a lot of environmental factors. And they come together and they give that chronic skin inflammation. And as I told you, although it's not dangerous, it's not a disease you die from, although I've seen children ending up at the ICU with eczema because they develop staph sepsis through the skin. Children who don't want to get treated, and they just live with the eczema, and then the germs become so common, so high in concentration that they cause staph sepsis. But of course, looks, itch, schoolism, they are miserable, they are isolated, they are depressed, and it affects the whole family. And that's why you have to treat it. And I'm going to say a few words on the treatment of eczema. So it's a group of diseases, and it's a skin barrier defect that is the primary abnormality. So when they come to my clinic, and I see a lot of eczema, the first thing I tell them is I cannot cure eczema. And there's no doctor in the world and no doctor on the internet who can cure eczema. Yeah? But what I can do, I can help you to control it. I can avoid complications. I can tell you how to live with your eczema. And I also will be able to improve the quality of your life. But treating eczema is a collaboration. It's like a soccer team. It's Chelsea. You know Chelsea? Man United. Eczema, I am the coach and you are the team. So I tell you what to do. And you have to listen to me. And if you listen to me, you will be thankful. Don't have to, but you will be thankful because your life will get better. And I will avoid this complications. Especially for girls, it's terrible. If you don't treat eczema, they end up with dark spots on their legs. And once you have those dark spots, it can be for the rest of your life. Yeah? And when you're a girl, you want to have beautiful skin. So that's one of the reasons to treat eczema is to avoid the scarring of the skin. And of course there are 4 principles. To treat eczema is not just prescribing a cream, you know. If you only prescribe a cream to treat eczema, you're not a good doctor. You should have an impact on their lifestyle. It's holistic package and it must be safe. Because of course everybody can treat eczema. You prescribe them high dose of oral steroids, but that's not a treatment for a long time. Because I'm going to show you one child, this child, and he was prescribed a lot of topical steroids. And he developed Cushing syndrome. And this is a typical history we see in Singapore. You have a very good mother. A good mother, and she wants to get her child cured. So she goes to different doctors. And every doctor prescribes steroids. And the mother puts all the steroids on the skin of the baby, and then you have a baby who will develop Cushing. So it's very important to talk to your parents and to tell them that you cannot cure. Because parents always keep looking for the perfect doctor who can cure the eczema. And that perfect doctor, he doesn't exist. We cannot cure eczema. So, what are the cornerstones? I think you should come with a detailed diagnosis. Eczema is a syndrome. It's not one disease. You have to find the triggers. And it's a dynamic disease, so triggers can come and go, can change. And you have to find out the skin type of your child. And some children have a very dry skin, and other children have a less dry skin. And then, the 3 cornerstones of treatment are moisturizers, topical corticosteroids, and don't forget antiseptics. Why antiseptics? To keep your germs low. And if you don't keep your germs low, your corticosteroids will not work. And then you have to distinguish patch treatment, treatment of the patches of eczema, and then global skincare. Global skincare to avoid, to prevent new patches of eczema. And this is very interesting. Just a month ago, it was shown that if you have a newborn baby with a dry skin and you put moisturizer, and this is a study from UK and a study from Japan, showing that by using early moisturizers and you cover your baby, you can prevent allergy and you can prevent eczema. So here, and this is very new, we have a new treatment, actually a safe new treatment to avoid eczema. We should create a barrier. We should create an extra barrier on the skin of the baby so allergens cannot come in.